I do much more than just popping pimples in terms of the realm of dermatology. But yeah, I couldn't get here if I didn't have that knowledge and that experience and that training. Just starting with a blackhead, a simple, beautiful blackhead that popped out of the skin, and we posted it on social media and it took off and people just fell in love with it. So blackheads and whiteheads are comedones, open and closed comedones, and they're really like the building block of pimples too. You get a pore that gets filled with sebum and oil, dead skin cells, and that's a blackhead. And those are the things that can be very easily extracted, usually softened. Maybe put a little salicylic acid cleanser on your face or some products that can help to exfoliate you. And then you might use a comedone extractor, which is what we use to kind of express those. So those are very simple, very basic. Most people will notice them on the more oily parts of their face, like their nose, their forehead, and their medial or the middle cheeks and chin. A blackhead is going to be a dark spot there that is really like in a pore. And the reason it's dark is it's oxidized, meaning it's exposed to oxygen. And so this actually darkens it. Just like you cut an apple, right? And if you let it sit out, then it's going to turn brown. So a whitehead is a blackhead, but with a fine layer of skin overlying it, meaning that it's not exposed to oxygen, so it doesn't oxidize. It's like an uncut apple. So it's still white underneath because it just hasn't been exposed. Blackheads and whiteheads, you want to really clear those pores out, right? So you want products that are going to help to clear out those pores. Things that are going to exfoliate, like chemical peel acids, salicylic acid, glycolic acid, lactic acid. Those are going to help to keep those pores clear. Retinol or tretinoin are great products too because they really increase the efficiency of your cell turnover. Your dead skin cells don't stay on the surface of your skin as longer than they're needed, so they don't have the potential to clog up your pores. And sometimes you might think something is a blackhead, you're like almost positive it is, and nothing comes out. And those are the ones that I want to caution you, or anybody. If you find yourself squeezing something and it's not going away, you got to put that comedone extractor down. You got to even set a timer, if you have a hard time with that, and say, okay, after 30 seconds, I'm not going to do this anymore because obviously there's nothing there. What's nice about them is the ones that I use have a loop on them, so you can really apply even compression on all sides. Sometimes when you go at it at one side, it won't happen, but if you come at it the other way, it will. And it allows you to kind of choose which side you want to put pressure on. When you see in a cartoon like a big pimple that's ready to pop, technically we may call them whiteheads, but it's actually not a whitehead. Those are pustules. Not angry, it doesn't hurt, it's just more like one of those little kind of spots that are like blackheads but just covered with a layer of skin. The next step is an inflammatory papule or a pimple, what we call a pimple, which is when it's red and angry. That's really when bacteria decides to get involved and it realizes that this pore with all this dirt and debris and oil is like a perfect environment for it to camp up, and it just tries to live and grow and eats. It's like nice and warm and cozy in there, and so it actually inflames the area. So that's why it gets red and irritated. Actually, your body's creating it's really using its immune system to come and fight it off. So it gets red and angry. It turns into a pustule as you're trying to kick them out of this area, and that's what you see as a pimple. That's really painful, and it's out there, it's white. When you have a pimple that is there and it's there, and obviously you have a big event coming up, ideally you want to have it injected with a little low potency corticosteroid, because that will essentially get rid of it or calm it down within like a day or less. That's not always easy, right? Because you don't always have a dermatologist on call. If you don't, the next best thing is to put a pimple patch on it that's medicated, because it'll help keep your hands off of it, because you don't want to squeeze it at that time. Because if you squeeze it, and we've all been there, it'll just make it bigger, it'll make it redder, it'll make it potentially worse in the long run. Because the ideal moment, there is a moment when you have an active pimple in this phase where you can kind of express it, and that's when it's the most superficial in your skin, and when it is not technically a whitehead but a pustule. So that's because that pus is essentially really close to the surface, and a little light maybe nick with a needle or a lancet will help to express the contents. You can get that all out. The next step and the most sort of severe form of acne or pimples is the cysts or the nodules. Those are more deeper seated acne bumps, and it's more of like a severe form of acne. And the problem with that is that they are more painful, they're more noticeable, and also they have a much higher potential to scar. And that is really where we dermatologists come in and say, you know what, you really need to be more aggressive or more, trying to pursue treatment in this way, because you don't want to be left with scars, because that could be forever, and those are very difficult to treat once you get them. Sometimes they sit under there and they come up, especially during certain times of the month, like hormonal shifts in our body, and then they'll come back down and then they'll come back up again. And so sometimes they even change into that cyst, just to confuse you, because it goes with the same name. The cysts that you might see me talk about, where I squeeze out of the skin, those epidermoid cysts, which are a different category, really. But we call them both cysts. They're really infuriating, right? Because you have these things under your skin, you can feel them, and a lot of times they can really make your skin look, you're embarrassed of this. There's a lot of nodules on your skin, and they never seem to really, some of them never really seem to end. They just keep lingering on. You really want to seek out a dermatologist care at that point, because there are great medications that we can use that are prescription that can help you clear up that acne. But that's really what you need at that point. You really want to take something systemically, meaning something that can work from the inside out to inhibit your oil glands, to help inhibit those hormones specifically that causes your acne breakout.